Hi, ladies. Thank you so much for joining me on this webinar with information about your postpartum experience. I know this is a super crazy time right now, so I hope this is a voice of reason, voice of calm. It gives you a lot of information to use, because I know when that baby came out, didn't come with the blueprint. I know, especially if this is your first one, there's a lot of crazy thoughts going through your head. Is this normal? Is that normal? What do I do? When do I do? And so I hope this gives you a lot of peace, more understanding about what's going on during this time. If this is your second or third or fourth, you don't have to be an expert, but a lot of this information still should be super, super helpful. As always, if you're watching this and you know other ladies that have new babies or are suffering from postpartum anxiety, depression, they have low back pain or sciatic pain, definitely show them this video so that they don't have to live with that stuff forever, because there is help out there. There's things that we can do to help every mom feel better in their postpartum experience. As you are experiencing having a newborn is one of the most rewarding experiences of your life. We just went through this in my family. My firstborn is 3, she's gonna be 4 pretty soon. And then my second one just turned 7 months just the other day. We had 2 very, very different postpartum experiences. From the first, we attempted home birth, and we ended up having to transfer to the hospital, not for emergency reasons, but ended up having the baby with an epidural, with the Pitocin, with the OB, kind of delivering the baby and, all that stuff, kind of more of a high stress scenario, to having a baby at home with the midwife in our own bed, in our own home. It was absolutely amazing. So wherever you had your birthing experience, this video is going to help you, and I can be of help to you because we have experience, really doing both. I'm really, really passionate about this topic because most of the time, the pregnancy, you get all the attention, right? Because we can't really see the baby. Obviously, there's little appointments to hear the baby's heartbeat or things like that. But we're focused on you, your hormones, your chemicals, your nutrition, your well-being. And then once the baby comes out, as you're probably experiencing, almost all the focus goes on the baby. And I understand it. You have this new baby, like they send you home from the hospital without instructions on what to do. You're just expected to kind of know what to do when you're taking care of this baby. It's nerve-wracking. I remember taking my firstborn home, being responsible for driving everyone home, and I've never driven so slow in my life. So I know what it's like when you have this newborn. And so, like I said, I hope this information is super helpful for you to kind of help you have a rough blueprint on what we're gonna do, what to do, through this postpartum experience. Now, how we're gonna frame this talk is we're gonna be talking about things that can cause stress in you or the baby. And then in the end, we're gonna talk about what are things that we can be doing, and kind of throughout as well, to mitigate this stress, to give your bodies the best chance to grow, to develop, and to stay in that state of ease. Understanding these stresses is really, really important because as a chiropractor, I'm not just focused on stress from your external environment. I'm focused on stress in your internal environment. And I'm focused on how the stress in your external environment is affecting your internal environment. Specifically speaking, when we look at your spine, I'm gonna grab my spine here. Everything is translated, all the information that you're getting from the environment is translated through your nervous system. That's what your communication relay system. It goes from your senses, touch, taste, feel, smell, see, to these nerves and into the information highway, which is your spinal cord, all the way up to your brain, where your brain processes this information and decides what to do with it. At that point, it'll send a message back down through this communication highway, out through the nerves to whatever body part is needed to adapt to your specific environment every moment, every second, whether it's a gross body movement through your leg or through your arm, or a micro change such as the skin temperature on your shoulder, to little changes within your digestive system or in your hormones. Everything is processed and organized through your brain and through your central nervous system. Now, the accumulation of these 3 stresses, from physical stress, which we'll talk about where that comes from, to chemical stress and emotional stress, that overloads this nervous system and actually triggers this whole stress system. We call it the fight or flight system, and this can become chronic. And this is one of the leading causes of inflammation, which is the leading cause of almost every chronic disease known to man, but also could be the cause of things like postpartum depression, postpartum anxiety, sciatic pain, or your digestive system not working the way it's supposed to. Sleep, especially, I know it's hard to sleep with a baby, a newborn baby, but even when the baby's asleep, sometimes ladies have a hard time sleeping in postpartum. These accumulation of stresses actually affect the spine. When the spine stops moving the way it's supposed to, because when you get stressed, your muscles tighten up, that'll lock up these joints. That interference and distorts the communication system going between your brain and your body and your outside environment. If that information system gets distorted, that's going to automatically trigger your stress response, which, like I mentioned earlier, it causes your digestive system not to work right. It dysregulates your immune system, dysregulates your hormonal and neurotransmitters. It causes your muscles to work not how they're supposed to. And so with those dysfunctions come symptoms, okay? And that's kind of our whole philosophy of health, is we don't want to give a medication or a drug or a surgery to cover up a symptom unless it's necessary. We want to go to the root cause and help the body heal itself. So by understanding where these stresses are coming from, it's going to help you mitigate those stresses, thus ease the stress on your spine, thus give your body the best chance to stay in the state of growth and repair. The first one that we're going to talk about is physical stressors, okay? Now, as you've experienced, the birth process isn't exactly a walk in the park. I've never done it myself, obviously being a guy, but being with my wife through a hospital birth and through a home birth, it is a very, very, very intense experience. And so it's possible that depending on your position, depending on how long, depending upon the way your muscles are contracting on the inside, it's very possible that that physical stress of labor and delivery, and even during your pregnancy, as your body starts to expand and change as the baby gets bigger, it's possible that that was enough to cause the body to go into a chronic state of stress because of the alignment of the spine and the stress on the pelvis, the sacrum, and the low back. When we're looking at physical stresses on the baby, it's very easy to see, especially you dads, if you watch the baby come out, or if your baby was born via C-section or had a long labor or delivery, the stress on the baby going through the birth canal. I've seen lots and lots of babies come out, of the birth process, whether they're colicky or refluxy, aren't latching the way they're supposed to, are constipated, and those are signs and symptoms in the baby of chronic stress, or even, I guess, chronic stress in them being a day old. They've had stress, their entire life. And so those are things that we want to make sure that we're addressing. If the baby has been under a physical stress, if the mom has been under a physical stress, it's likely that they need a chiropractic appointment to help reduce that stress on their nervous system by getting their spine moving the way it's supposed to. The second one that we like to look at is emotional stress, okay? And I know, especially in today's day and age, with the dads a lot of the times working, especially in my area, we live in a huge commuter area where you're commuting to Orange County or San Diego, where a lot of the times the moms are left alone, or even the moms are working, especially my nurses. I always say my pregnant nurses are the worst because they're working 24-hour shifts, they're on their feet, they're lifting things that they shouldn't, that they aren't supposed to, and then they go home alone. And so that can be a really difficult thing to deal with. Is this right? Is this not right? Not feeling comforted, not being able to take off work because you need to provide financially. Those same stresses that you have during your pregnancy are translated through hormones and chemicals in your body, which the baby is created to pick up and translate in their own bodies. So if you are in a chronic state of stress because of emotional stress, the baby is also picking those stress signals up. And when the baby could come out thinking or expecting a stressful outside environment. It's why I always tell my mom, and we're going to go over stress mitigating strategies at the end, but what I always tell my mom is really, really important that you either subconsciously or even verbally, externally, be communicating with your baby, especially if you go through a stressful experience, you have a stressful conversation, or something happened at work or whatever, that you have that conversation. When the stress is over, you communicate that, baby, everything is okay. And that's gonna literally calm your inside environment, which is gonna help the baby know from you that everything is okay, mom is okay on the outside. So we've talked about physical stress, we've talked about emotional stress. The last one that we're gonna go over is a chemical stress. And I know this one might be the most confusing because when you're pregnant, you're trying to eat everything that you're supposed to, not everything out there, right? Everything that you're supposed to, you're taking good prenatals, you're trying to eat organic food, trying to eat things that are gonna support the growth of a new baby, avoiding the ice cream and pickles and things like that. There's a study out of Quebec, Canada that showed that in the cord blood, they sampled cord blood, there was already pesticides, there was already carcinogens, there's already things that are harmful to our bodies. And so just being exposed to our outside environment, whether it's to GMO'd foods, whether it's what they're doing to our air or to our water, All these things are accumulating in our blood, especially if we don't have a good detoxification system. And so there can definitely be chemical stress, even in ladies that eat organic, take supplements, detoxes, do all those sort of things, just because of the way our environment is, especially here in Southern California. And so chemical stress is real, and it's something that can cause a significant amount of stress, not only in you, but also in the baby. And so going over some tips now on how to reduce the stress for mom and baby. My number one tip, obviously being a pediatric and prenatal chiropractor, is to get checked by a pediatric and prenatal chiropractor. We have a really unique experience here at Trailhead Family Chiropractic, where we don't just lay you down, feel your spine, adjust you, and hope it's gonna get better without a plan. We actually measure what's going on within your spine through the use of infrared thermography. So that measures inflammation from your low back all the way to your neck. One of the number one results of stress is inflammation. So that inflammation reading is gonna give us an idea of where in your spine it's not moving right, causing that stress in your nervous system, causing your whole entire body, every cell in your body to be stressed. It helps us pinpoint where it is. It also helps us figure out how bad it is. The second thing that we'll do, and the moms, not necessarily the babies, and all the babies, we do an infrared thermography scan, is we do a surface EMG scan, and that measures muscle tone, which shows us from the low back all the way to the base of the skull where the muscle tightness is. When your muscles are tight, that's gonna cause the joints to not move the way they're supposed to, which triggers that sympathetic fight or flight nervous system, which takes the mom out of the state of relaxation, growth, and development. And so those two tests give us a really good objective view of where the problem is and how bad it is, which gives us the opportunity to make a plan. So we know how many adjustments over what period of time, and that way we're also able to remeasure. So we know here's where you're at, here's where our goal is, and here's how you're doing in between. And a lot of moms, everybody really likes to have a plan, because if you're spending money, if you're doing something that you don't really understand why or when the end result, what the end result is, it makes it difficult. It makes it difficult to understand why you're coming. And so this is the unique Trailhead experience that gives you the opportunity to know what's wrong inside your body, inside your baby's body. And it really gives us the opportunity to stray away from just a symptomatic relief, but going into helping your body function optimally the way it was designed to. And we get to focus on you. That's the next thing, is make sure that you take care of yourselves, moms. It's super easy to just put all the attention on the baby like we talked about, and a good amount of attention should be on the baby. But it's really, really important that you help your body rehab, because if you don't, that's gonna give you pain when later. It made me change your ability to have a second baby. And so I really, really want to make sure that you are taking care of yourself, so that way you're able to keep up with all the baby's milestones. You're running around when the baby's running around. You're jumping on the trampoline when the baby's jumping on the trampoline. You're rock climbing when the kid can rock climb. And so it's really, really important that we make sure we take care of you now, so the problem doesn't get worse in the future. The next thing, really don't be afraid to ask for help, either from your doula, from your midwife, from your chiropractor, from your mother-in-law, from friends and family. I know it can be really difficult to ask for help, especially in our kind of Southern California American culture, but we really want to make sure that you're asking for help, because if you don't ask, you're going to live in fear. You're going to live in this self-isolation that I am alone, nobody else is going through this, and we want to make sure that you are not alone. That you do know that there's other people that can help you out with what you're dealing with. I also want you to know that as a mom, you've been a mom for whether it is a couple of minutes. I hope you're not watching this a couple of minutes after birth, but when you were a mom a couple of minutes to 5 minutes to an hour to days and weeks and months, you're gonna have mom instincts. Those develop the second that you become a mom. I really want to emphasize for you to trust your mom instincts, because that's gonna take you a long way. And research your instincts. If you're not sure if this is right or that's wrong, there's research. And then also, it takes a tribe. Okay, so know that we are here to help you. We are here to make sure that your pregnancy goes well. If we didn't see you during your pregnancy, we're here to make sure that your postpartum experience, we put your body back together the way it's supposed to, so that you can have the optimal life experience. So I'd love to end on a couple testimonials. First of all, being my wife. Like I said, we have 2 kids. I adjusted her throughout her pregnancy experience and postpartum. She actually had the spinal headache after the first one. And the adjustment was really the only thing that was giving her a little bit of relief. So that was really amazing. And then the next testimonial, I had a mom that had a baby, went through the whole pregnancy experience, never experiencing chiropractic. And then her second pregnancy, pretty early on, she started to get a sciatic pain that she kind of had in the first one, but it was way worse. Barely even able to walk. We got her adjusted. Her sciatic pain went away pretty quickly, which is awesome, but she maintained her chiropractic care throughout the course of her whole entire pregnancy. And she came back in a couple weeks later after the baby was born and let us know that her postpartum experience was way different and way better than she had with her first one, because her body was more adaptable. Her body was in a state of growth and repair and relaxation rather than in a chronic state of stress, which allows your body to heal efficiently and optimally. Now, if you're pregnant right now and watching this, just preparing for the postpartum experience, and you don't have a chiropractor, or you're postpartum now, or you're 5 years or 10 years even postpartum. So if the information in this webinar resonates with you, and you feel like I can be a helpful part of your team, we would love to schedule your consultation. We do offer a special offer for everybody that watches this webinar. Our number is 951-698-4848. You can call us or text us. You can even reach out on Facebook or Instagram, in any way that is convenient for you to get scheduled. We want to make that happen because we care about you. We want you to make sure that you're able to play with your kids, do whatever you want, travel, do whatever you want without the limitations of chemical stress, emotional stress, physical stress, affecting the way that you interact and adapt and enjoy and interact with your environment and with this world. We also see newborns. For my first two, I adjusted my first one at 30 minutes old, my second one at 5 minutes old. It's very, very different than getting an adult adjusted. It's just small touches, moving left or moving right. It's nothing dramatic at all. It's actually very anticlimactic. But if your baby is having problems nursing, if your baby is constipated, fussy, colicky, or just overall tense and not sleeping well, that would be a great sign that your baby needs a chiropractor, because they are in a state of stress, and we can help them move into a state of growth and development and ease. If you know anybody that needs this information, please share it with them. It could make the difference between a wonderful pregnancy experience and not having another kid again, or having pain and just dealing with it, or having pain and worse, being addicted to medication. Literally, this is what I do to help change the world. Be a part of that team with me, and let's get your appointment scheduled and share this information. Have a wonderful day.